those who will join us today.
Vamos a esperar aquí un minuto.
We'll wait for 1 minute.
Fantástico, ya hemos superado los 100 participantes.
We have more than 100 participants already.
Perfecto. Bueno, yo creo que
Well,
mientras
I believe
los
that
participantes siguen conectándose, yo creo que podríamos
while
empezar
participants
sesión
continue to
con
connect,
las
we can
palabras de
start with
bienvenida.
this session and the welcome
Buenos
words.
días y bienvenidos
Good
a
morning,
todos, a los
everybody,
aquí presentes a la sesión de hoy. Mi
and
nombre es
welcome
Ana
to
Rivera.
today's
Soy la representante de la
session.
OPS-OMS aquí en Panamá.
My name is
Y por
Anna,
la
and
próxima hora y media tendré el
welcome
gusto
you
de poder acompañarlos
to
como moderadora en
this
este evento.
session today, and I will
Este
be
es
the
un seminario
moderator
virtual
also. It's a
que
virtual
forma parte de una
seminary
serie de
that is
seminarios
part of a
dirigiendo sobre la
series of
atención primaria en
seminars
salud.
that we are
Para ello,
organizing
oficial
about
y el refuerzo
primary
nacional
health care,
titulado La implementación de las
and
FESP en
it
las Américas,
also has to
propagación y
do with
fortalecimiento
the
de las
essential public
capacidades,
health functions
publicado
to
por
be
la
implemented in the
OPS.
Americas.
Contamos con un grupo muy
And
distinguido
there's
de
a regional
panelistas a los que
report that we
queremos
will hear about
agradecer
today.
especialmente por
We
haber
want to
aceptado
thank
acompañarnos en esta oportunidad,
all of
quienes
you
iremos
who are with
presentando
us today,
continuamente.
and we will introduce
Mientras
our
tanto, y
speakers
antes de comenzar, quiero comentarles que
when the
debido a
time
los
comes.
ofrecimiento de
I will
interpretación simultánea que tenemos tanto en
tell
inglés,
you
español,
about our
francés y
interpretation
portugués,
services,
por lo que por favor
both
iniciaré
English,
idioma
Spanish,
federal.
Portuguese, French,
Como se
and
comentará,
sign
para escoger el
language.
idioma deberán presionar el
And
botón
so you, of course,
escogido en
can
la parte inferior
choose
de la pantalla Zoom. También
the
contamos con interpretación
language you want to
simultánea
hear this
desde los
session
recintos
in the
internacionales,
lower
que
part of
ustedes
the
podrán ver
screen.
en la pantalla durante
You
toda la
can see
sesión.
also the international sign
Tengan en
language
cuenta que pueden
interpreters
enviar
on
sus
the
comentarios
screen.
en cualquier momento y a
You
través
can add
del chat.
or state your
Y les
comments
recordamos,
anytime
sobre
you
todo a los
want
colegas
through the
panelistas
chat.
y de la
And we would
organización,
like to ask the
que mantengan
panelists
sus
and
micrófonos apagados para
organizers
poder, obviamente,
to
facilitar
keep
el desarrollo
their
de la actividad.
microphones
Y por último,
turned
les
off
pedimos también a los panelistas
during the
participar
session.
a
And
hablar
we
muy
also
rápido para poder
ask
entenderlos
the
y para
participants and
facilitar el
speakers
trabajo de la interpretación.
not to speak too fast in order to
Y bueno, para dar
facilitate the work
inicio a
of
este
our
seminario,
interpreters. In order
es un
to
placer
start
para mí
our
invitar a
webinar,
presentar al director de la Organización
I would
Panamericana de
like
la Salud, el doctor
to
Jarbas Barbosa,
introduce Dr.
a quien
Jarbas
le cedo la
Barbosa,
palabra.
Director of the
Adelante, doctor
Panamericana
Barbosa.
Health Organization. Dr.
Muchas
Barbosa, please
gracias.
go ahead.
Buenos días. Gracias, Ana.
Good
Buenos días.
morning,
Primero
everyone.
quería mucho
Uh,
felicitar
I
todo el
would
equipo
like
de la
to
OPS que está
congratulate the whole
involucrada con
team
el tema
of
de
PAHO that is involved
las funciones esenciales de salud pública
in
y
essential
de
public
estos
health
seminarios
functions
alrededor de
for
la atención
these
primaria. Tenemos más de
seminars about
930 personas
primary
conectadas,
health care.
lo que yo creo que es una
And
buena
I
muestra
believe that this
del
is a
interés
good sample
de
of
la
the
región, de todos
interests
los
of the
científicos de la
region,
región, de los
all
funcionarios de los
health
ministerios
professionals
de
and
salud, de
all
nuestros
officials of the
temas que
different
son
ministries
importantes. Una
about this
felicitación también en nombre de
important
Ernesto
issue.
Bastos, envío un saludo
So
y
I
una
send you
felicitación
greetings
para
from
todo
Ernesto
nuestro
Bascono
equipo.
to all our
Buenos días
team.
primeiro de nuevo a todos.
Good morning
É realmente
again.
um prazer
It's a
para a
pleasure
Organização
for
Pan-Americana
the
da
Pan
Saúde
American Health
poder
Organization
contar com
to
sua
have your
participação
participation
para
in
celebrar o
celebrating
lançamento do
the
relatório
launch
regional de
of
las
the
funciones
regional
essenciales de
report
saúde
on the essential public health functions, EPHF, about implementation of the essential public health functions in the Americas, evaluation and strengthening of capacities. That's the title of this report. We are at a crucial moment in the advancement through resilient, equitable, and universal health systems based on primary health care. The essential public health functions play a fundamental role in complementing and strengthening primary healthcare systems. This strategic framework offers us a clear roadmap for improving the capacity of response of our health systems and aligning our efforts with the SDGs, the Sustainable Development Goals. In the region of the Americas, we have made significant progress during the last 4 years by implementing the renewed EPHF. So far, 18 countries have conducted and adapted the EPHF assessment. It has been been received very well in our continent, and they have evaluated and identified priorities that have led to the development of strategic action plans. The experiences and results of 14 of these assessments are presented in the regional report, highlighting the diverse levels of capacity development across our region. Beyond the assessment, several countries have incorporated EPHF as a key input in the development of national health plans and policies, and others have strengthened the capacities of local health authorities through territorial work. Other important examples from the countries include the design of PHC-based models for care and incorporating EPHF and the development of governance structure to implement of the EPHF.
In response, our member states approved the strategy for strengthening the essential public health functions to accelerate health system transformation 2024 to 2034 in September last year during our directing council. This strategy aims to guide and support countries in implementing policies and measures that promote a comprehensive approach to primary health care through a renewed focus on the essential public health functions. By prioritizing essential public health functions, health authorities can support the development of more resilient and effective health systems capable of meeting their population's current and future health needs. In the next hour, this webinar will explore how health leaders, policymakers, and stakeholders can leverage the EPHF to accelerate health system transformation, strengthen capacities, and advance sustainable development in the Americas. The comprehensive methodology for evaluation and capacity strengthening will be presented, offering a regional situational analysis, and we will hear an exchange of country experience in the strategic application of EPHF results. Let us continue this journey towards building resilient and equitable health system together. Utilizing this methodology, this strategy, to drive substantial improvements in health system capacity and ultimately health outcomes across our region. This is really important because you know that one of the characteristics that you have in several national health systems in our region is the fragmentation, is the lack of leadership, is the lack of a clear definition about the roles of the leadership of the Ministry of Health. So I think that is really important to have not only the assessment, but also because the assessment allows the country to develop a roadmap, a plan of action, and see what are the dimensions that it needed to receive more technical cooperation from our side and to strengthen their capacity at the national level. Thank you for your continued commitment to improving the health of the people in the Americas, and I wish you a productive and insightful webinar. Thank you. Back to you, Ana.
Thank you very much, Dr. Barbosa. Muchísimas gracias por estas palabras. Y bueno, para poder contextualizar un poquito, iniciar la
Thank you
conversación.
very much for your kind words. We would like to invite Dr. Ernesto Báscolo, head of the Unit for Primary Health Care at PAHO. And well, you have the floor. Thank you, Ana. It's a great meeting. We have about 1,200 people here with us, and we thank Dr. Sarabas that has done a lot to facilitate this cooperation and these meetings. In order to talk about the present context, especially about the resolution of strengthening essential public health functions, we have to take into account the last decades and our evolution in this agenda. I would also like to mention a part of all the milestones we have reached since 1988 up to date. For me, there are 4 stages that have been crucial in our region. First of all, we have the advocacy and the role of the CDC in the United States, telling us all about the essential public health functions and the need to enhance public health, as we say in Latin America, collective health, trying to guarantee its prioritization over individual services, above individual services. And of course, PAHO's participation was crucial in this sense, starting in the year 2000 with the resolution of certain mandates and resolutions by PAHO by putting the essential public health functions in line with something that was quite innovative at that time, and that had to do with with directing these efforts. During the 90s, we saw restrictions of the role of health authorities, and that was a crucial moment. I believe that in our organization, the essential public health functions, with a structural point of view, strengthening the systems. And since 2014, we have the Universal Health Agenda and Sustainable Health. And at that time, it was an advocacy period because we were rescuing the essential functions of public health as part of the agenda of the universal health care. But I would like to say, and I have the support of Dr. Barbosa in this, and since 2020 up to now, this advocacy turned into a very active technical cooperation on the side of the organization that was not only present in the strategic plan of PAHO with the presentation of the new framework of essential public health functions, and also the implementation and use of the toolkit for these functions that was launched in 2021 and has been implemented since. And the present webinar has to do precisely with an analysis about this process. Next slide, please. And finally, I would like to point out that during this last stage, we emphasized the reconceptualization of public health functions, not only as priority interventions, but also as a training of all the authorities and responsible for public health care. And in this sense, the essential functions are not only an advocacy of something we have to prioritize, but an axis for the transformation of health systems. And within this framework, we have two important aspects, two key aspects. One is a point of view from a focus on the cycles. And so we interpret the capacities based on an analysis of the problems of the population in different territories and contexts. And in the second place, the capacities to the skills to formulate public health policies, and in the third place, to recognize that these policies can be implemented if we have human and the financial resources and also medication and all necessary equipment. And there's also a central point of view on the access not only for individual services, but also collective services. This component is directly linked to the three pillars of primary healthcare. Primary healthcare incorporates not only the intersectoral focus and the empowerment of people and communities, but also integrated services where the essential functions have a crucial role. And this is why last year the member states, PAHO member states, have approved a resolution that we consider very strategic and of structural importance, with three lines of action. And these lines of action focus on three aspects that are key for strengthening our health systems. The first one is to strengthen the leadership and the stewardship and governance of health systems. The second one is to strengthen the capacity of evaluating essential public health functions by linking them together, not only at subnational level, but also at national level, especially for those territories that are in a weaker situation. And then to strengthen the skills of our public health staff in order to apply these essential functions in the best way possible. Not only the subjects have to be trained, but the subjects also make it possible to strengthen our health systems in each one of our territories. Next one, and finally, I would like to point out that to push forward such an agenda, such a huge agenda, is only possible with the commitment of the authorities, health authorities of member states, and of course, incorporating other alliances. I would like to point out the Primary Healthcare Alliance that incorporates the IDB and the World Bank, and also all technical departments of PAHO. And we have to broaden this alliance with all actors that are committed to public health and its essential functions. And here we are working on launching a space that will support the interaction and cooperation at regional level. And this agenda, this space, will be linked through a network, will be linked to a network of essential public health functions, and it will take into account learning and innovation and experiences. We will share experiences, we will develop strategies adapted to different contexts. And the thematic axes are structure and governance for developing EPHF, and also to transform the health systems in the region. This is the last part, so thank you very much, Anna, for the time, and congratulations for organizing this webinar.
Perfecto. Muchísimas
Thank you,
gracias, Ernesto.
Ernesto.
Y gracias también por mantenerte
And
dentro de
thank you also for keeping within
ya
the
casi
stipulated
400
time frame.
participantes.
We have 1,400 participants now.
Quisiera también
And I would also like to thank you for your presentation that provides a framework for the situation in the region. And now we will listen to Natalia Ponten, who is an officer on EPHF at PAHO. And well, Natalia, you have about 15 minutes. Thank you, Anna. Can you see my presentation? Thank you very much. Yes, we can see it. Well, thank you very much for this introduction and the words of Dr. Barbosa and Ernesto. And I have the pleasure and the honor of showing you this regional publication about EPHF in the Americas and with the strengthening of capacities, development and strengthening of capacities. It is in two languages, Spanish and English, and it will be published soon in the other official languages of our organization. And the idea is to take a renewed point of view, a new point of view on these elements, conceptual elements that were mentioned by Ernesto, not only by offering more practical guidelines and directions for the public health functions at all levels, national, subnational, and local. The document has 5 sections. The first section provides the regional context. The next one talks about the beginnings and conceptual pillars. Then we have in section 3 the methodologies and tools to assess and strengthen the essential health functions with practical tools. Section 4 provides a regional analysis based on the experience of 14 countries that had implemented this renewed structure up to December last year. And section 5 states recommendations for applying guidelines. And here we have the renewed framework of EPHF. This is a very important component of primary health care, and it is focused on the policy cycles. The 11 functions are organized in this very important component of evaluation, policies, resources, and access. And so the argument is that essential public health functions provide us a comprehensive point of view of health systems. The next component is the component of capacities that was also mentioned by Ernesto. I would like to expand a little bit of this issue. When we're talking about renewal and strengthening, well, we're talking about 4 necessary capacities for EPHF. The formal capacity that has to do with these regulations and frameworks from PAHO to exercise this role of essential functions. The structural capacity that has to do with mechanisms and structures and governance structure. And the next one has to do with supervision, with the monitoring and evaluation, and also the the accountability that facilitate the execution. And of course, we also need well-trained staff in order to carry out these EPHF. The next component, important component that is part of the conceptual base, is that the implementation of functions are part of a structure, an institutional structure of health systems, and this structure is the result of transformation processes that have taken place in health systems and that have defended the regulatory frameworks that were there since the beginning, but they have been changed a long time. It also takes into account people. Ernesto mentioned the professionals that are part of the system and the implementation of EPHF. These transformation processes are part of our institutional configuration, and we know that in our health systems are different levels. These are segmented systems where different sectors take part, and there are important decentralization levels of the essential functions, and there is a strong participation of actors outside the health system. So this is also important, an important element to consider. And the rectorship of the health authorities and their capacities can be interpreted in the sense that mandates and the purposes established for each one of the institutions that are part of the health system, these have to be aligned with the essential functions, and also in what sense the authorities have an influence on the group of actors that are part of the system and that are developing essential public health functions. So based on all this, we have developed these methodologies for strengthening EPHF, and the purposes are to improve the capacities of rectorship and governance, and also orient the transformation of health systems, and to establish, and I want to underline this word, to establish a comprehensive mechanism, evaluation mechanism, the strengthening mechanism of capacities articulated at national, subnational, and local systems. And so we also have specific objectives to analyze institutional aspects, to measure the level of development of capacities, and to measure and to facilitate the implementation of these systems. The methodology, well, this is a sort of snapshot that summarizes the methodology, because here we have to point out that in each one of the countries, we have been adapting it to different contexts, national, subnational, and local. And there are different stages. So before going into the processes themselves, we have to evaluate the present situation. And here, hundreds of people have to participate, including public health schools that have had a fundamental role in many of these exercises. And then we have the different stages, the organization, the analysis of the situation, the institutional mapping, then the measurement of institutional capacities, and these two are offer a possibility of identifying and for implementing these national health plans. The publication, the central publication, is accompanied by 3 elements that are part of each of these these stages. We have a first supplement that is internal guidelines about the panorama of the health system. Then we have an interim guide for measuring the results. And then, what's the regional situation? The first thing we see here is that the publication is, has been carried, the evaluations have been carried out in 17 countries, and 10 countries have set up plans of action, and these plans are linked to the different levels that we have been mentioning as part of the national processes for transformation and reform of the health systems, and as a process for strengthening capacities at local or national level. And today, during the panel, we will listen to many of these experiences.
On institutional mapping, this graph actually summarizes, it's not a summary of the situation, but it tries to highlight an important element. In this sample, 6 countries with a mapping on institutions that are responsible for public health duties. With over 1,800 institutions identified, one can see that there are different levels of influence and alignment among those institutions with regards to healthcare authorities and a presidency that is present to a greater or lesser measure given by the size of the circles. Here it's important to highlight that most institutions identified are extra-sectorial. When we are discussing public health essential duties, with an alignment and influence that are medium, and there's also a significant number of institutions that are centralized and which belong to the healthcare sector, where this relationship between actors, institutions is facilitated with a greater level of alignment and influence. And of course, we have other institutions that are important here, such as Social Security or private extra sector institutions. And an element that I would like to highlight here as well is that though it acknowledges the participation of organized civil society, this has a presence that is much lesser in institutions with a high alignment with healthcare authorities, but with a medium influence, which is an important element to consider here. Now, this next chart also shows a summary on the level of existing capacities. Actually, the wealth in this information is much broader when one analyzes every country in its own situation. But what we would like to highlight here is undoubtedly there are many levels of development of those capabilities that I was telling, be it formal, structure, or in the carrying out of their duties, but there's variability in that level of development among countries. And for the essential duties, on average, most duties show a moderate capability, so it fulfills 40 or to 59% of the standards that have been established. However, in countries, for instance, in Latin America, there's a greater relative capacity with regards to, for instance, the Caribbean subregion, and only 35% of countries have reached a moderate level of capacity. Meanwhile, 43% have limited capacity. The reasons behind this are many, and here again, as a summary of that situation, we could say that most countries have a normative and legal framework. So the formal capability exists. There are structures that have been designed and established to facilitate implementation of essential duties, but there are still areas for improvement when we're thinking about supervision, assessment, and allotment of resources for implementation of these essential public healthcare duties. So these are like the pain points when we are thinking about the level of development for the duties. Here, I won't stop to discuss each of the areas, but what I would like to highlight is that in each of these exercises, or again, Hundreds of actors have participated in these assessment and strengthening processes. The countries have made a prioritization of gaps that have been identified as an outcome of those assessments, and they design their action plans and strategies for each of the functions grouped, in this case, into policies. So there is action prioritization regarding assessment, regarding policy development, regarding resource allotment, and regarding guaranteeing access. So here's some final reflections, also informed by the strategy to strengthen essential public healthcare duties. In other words, they gather reflections from all these exercises and the countries that have accompanied these processes. One of the things that are highlighted, and Ernest also mentioned this, and it's worthwhile to repeat here, and this is on the need to institutionalize assessment and ongoing improvement of capabilities processes. In other words, they should not be isolated practices in diagnostic and assessment, but they should actually be embedded in ongoing processes for improvement to the need of mechanisms for coordination, exchange, and alignment of policies and incentives among the many parties or stakeholders, improving and engaging communities and civil society organizations, and a matter that has always been a pain point that has been identified and therefore is highlighted in the strategy is on the need to strengthen the capabilities in the public healthcare staff for all 11 essential healthcare duties or functions. And undoubtedly, there's also we're also missing on the need to deepen on governance arrangements that are necessary and more effective to guarantee the carrying out of essential duties. I've ran this presentation, but undoubtedly this has been supported by many actors, so we cannot leave out um, our gratitude to each of the healthcare authorities in every country and every country office for PAHO that has also played an important leadership role in accompanying and directing these efforts in the countries, and also many colleagues and partners within PAHO and also country partners. Thank you so much.
Perfecto, muchísimas gracias, Natalia.
Great. Thank you so much, Natalia, for your presentation and also for being on time. Now, what we would like is, based on the presentations from Ernesto and Natalia, and also what's been shared with us and what we have shared via the chat, links to the documents mentioned in both presentations. What we would like now is for you to also have the possibility to review them in depth and to share them with your teams and on networks. The idea would now be to move on to a discussion panel, which would last about 50 minutes. We have 10 minutes for each of sorry, 5 minutes for each of the panelists. The idea is to promote an exchange of experiences between the different countries on enforcing the strategy for outcomes, with the goal to provide recommendations for action and ongoing improvement of FESP. We have prepared many questions to guide the discussion among our panelists, to whom we thank, obviously, again, for having accepted our invitation. It's a pleasure to have representatives from 3 countries that have implemented FESP in different situations. We have Dr. Andres Castañeda Prado, who coordinates the National Public Health Care Service from the Federal Secretariat Mexico. We have Dr. Capacities Valero Rosario, in charge of the Department for Sector Policies from the Office for Sectorial, the Ministry from the Dominican Republic, and Dr. Eduardo Guerrero, chair of the Colombian Association of Public Health, and to offer perspectives from the country level, from a more regional and global level. It's also a pleasure to have the presence of Dr. Vulcan Monar, Associate Professor and Director of the Jill Bovec Center for Caribbean and Latin America from George Washington University and the American Institute School of Public Health, and also Dr. Sahel Saikad, Senior Advisor on Public Health and responsible for resiliency of healthcare systems and public healthcare
la Organización
duties
Mundial de la
from
Salud.
the World Health
Muchísimas
Organization.
gracias a todos por su
Thank you so
presencia
much,
y
everyone,
su
for your
participación.
presence and your participation.
Iniciaríamos entonces con el doctor Castañeda.
We would begin then with Dr.
Doctor Castañeda,
Castañeda.
el modelo de atención
Dr.
de
Castañeda,
salud
the model of
para
attention for
bienestar
health,
más
for
bienestar.
well-being
Es el nuevo enfoque de
plus
atención
well-being is the new
primaria o de
perspective in
atención en
primary
salud
care
basada en los principios de APS
or healthcare based
que ha
on
implementado el gobierno de México.
principles that the Mexican government has implemented in the framework of more welfare.
Una nueva estructura de
A new
gobernanza por
structure
la
of governance
creación
has
del
been
Centro de
developed
Salud
with the creation of the
Pública
National
para reforzar
Public Health Care
la
Service to
coordinación de los
reinforce
secretariatos de
coordination
salud y
among
las
or between the
secretarías
Secretariat,
estatales. Además,
the Health
México
Secretariat,
ha
and the
llevado
state
a cabo una experiencia
secretariats of health.
pionera en
Also, Mexico has carried out a pioneering experience in
a nivel
assessment and
distrital
development
con los
of
estados de Sonora y la Ciudad de
PSP
México
at the district level with
liderando
the
este
states of
proceso.
Sonora and the city of Mexico leading
La
this process.
la pregunta para usted
The
sería la
question for
siguiente:
you would be
¿Cómo
as
el
follows:
SNS
how
mejora la coordinación
does
y la
SNS
implementación del
improve
assessment?
coordination and
¿Qué
implementation of
lecciones pueden
EPHF in
extraerse de la
Mexico, and what lessons can be
experiencia
extracted from the
de la aplicación
experience
del ASPES
of
para
the
seguir
enforcement
adaptando y
of
aplicando el ASPES
EPHF to
en
continue
diversos
applying them
ámbitos?
and implementing them in
Tiene
different
10 minutos
domains or
para
areas? I would give you 10
responder
minutes
esta pregunta.
to answer this question.
Muchas gracias, Ana. Muchas gracias
Thank you so much,
al
Anna,
maestro Ernesto, doctor Villarroel, por
and
el tiempo de
Ernesto, and the
compartir con
whole
ustedes
team to be able
lo
to share
que
with
estamos
you
haciendo
what we are
en
doing
México.
in
Si me permiten, voy
Mexico.
a compartir algunas láminas para
If you allow
intentar
me, I'll share
responder a
some
esta
slides
pregunta.
to try
¿Me
to
alcanza a
answer
ver?
this question. Let me know if you can see it.
Excelente. Pues bueno, un poco, primero aclarar, ¿no?
So first, to
Que
clarify that,
desde la creación del Servicio
since the
Nacional de Salud
creation of the
Pública
National
y el
Public Health
modelo
Care
Más
Service and
Bienestar
the Más
se
Bienestar or More
incorpora
Welfare
las
model,
funciones esenciales de salud pública
it
y su
includes
lógica, ¿no? Al diseño o al
public health
rediseño
care
y
essential
el proceso
duties
de
in the
transformación
redesign and
del
transformation
Sistema
process
Nacional de Salud
of the
en México,
national healthcare
en
system in
donde
Mexico, where
me voy a brincar a esta que
I
sigue,
will
que es
skip to
esta
this one
lámina
that
que muestra
follows.
de
The
manera muy
slide
gráfica qué es el
shows
modelo Más
how
Bienestar,
comprehensive the
que
model
desde
is.
el año
Since the
2022
year
se está
2022,
intentando implementar en México, y digo
it's
intentando
attempted
implementar
to
en
be
México
implemented
porque
in
es un
Mexico. And I
proceso
say
complejo,
attempted because
involucra
it's a
muchas
complex
instituciones,
process that involves many
involucra
institutions
muchos actores
and
y
involves
que
many
pues es un
actors,
proceso, ¿no? De
and it's a
implementación, y en ese
process of
sentido pues
implementation. And in
implica
that
que
sense,
pongan a las personas
what
en el
is
centro,
being sought is
pero
to
que
set
a su
people at
vez
the
haya
center, but in
una,
turn,
un balance,
there should
un
be
poco
a
como platicaba
balance,
Ernesto, entre la
as
salud
Ernesto was saying,
individual y la
between
salud
individual health
colectiva.
and collective health.
Y tiene algunos
And it
componentes
has some
importantes. Uno de
components that
ellos
are
es el
important, one
Servicio
of them
Nacional
being
de Salud
the
Pública,
National
por
Public Health
supuesto. Después
Service,
están
of
los
course.
distritos de salud
Then
para el
we
bienestar, que
have
ahora les platicaré un poco
districts for health for
qué es
well-being.
esto.
I'll
Por
later
parte del
explain what
Servicio
this
Nacional
is
de Salud
about as
Pública se
part of
implementan
the
los centros
public
coordinadores
healthcare
para el
service.
bienestar y están los servicios
Coordinating centers for
esenciales
health
de
are
salud
implemented, and
colectiva,
then we
las
have
prioridades o
public collective
las
health
acciones
essential
prioritarias de
services,
salud
and then
colectiva,
priority
y
actions
por
in
supuesto las
collective
funciones
health. And
de
of
las autoridades
course,
estatales de salud, que son las
the duties
responsables de
of
la rectoría
state healthcare
en su
authorities that
estado,
are responsible to
que
rule
son 32 estados aquí en México,
within
y
the
tiene
states,
varios
the
componentes,
32
como lo
states that we
podemos
have
ver
in
aquí,
Mexico, and we have
que
many
bueno, son
components as we see
componentes
here, which
que
are those components that
conocemos
we
bien.
know
Al
well.
final, un poco quiero
In the end,
aclarar
I would like
que
to
nos están ayudando
clarify
a
that
fortalecer este
they
modelo
are
también de
helping us to
atención
strengthen
primaria,
this model of
y que
primary care as well,
hemos tomado
and that we have
las funciones esenciales de
undertaken,
salud pública desde
we
varias
have taken
formas,
the
¿no?
essential duties in public
Primero,
health in many
las
ways.
funciones esenciales de
First,
salud pública ayudan al diseño de
they
la
help
estructura del
to
Servicio Nacional de Salud
design
Pública,
the
y ahorita
structure of
llegaré
the
a eso
national
en
public
otro motivo
healthcare system, and
de
I will
esta
get
plática,
there
pero
soon. It's
es
not the
importante
purpose
tenerlo
of
como
this talk,
contexto.
but it's
Y
important to have it
después,
as a
desde el
situation.
servicio, ¿no? Y quiero agradecer a
And
todo el
then
equipo
after
de
the service, and I
servicio
would
que
like
ha
to thank
colaborado
the
mucho
whole
con estas
service team
láminas y
that has
con este
collaborated
trabajo que
much
se ha
with
venido
these
haciendo
slides and this whole
los
effort
últimos
that's been
2 años.
carried out in the
Pero
last 2 years.
estamos creando
But
un
we are
modelo
creating
de
a model
evaluación
for
específico
assessment
de las funciones
specific and
de salud
essential
pública
duties in public health to
para
measure
medir estas, ¿no? En todas las etapas del ciclo
them
de las
throughout the
políticas,
stages of the
tomando
policy
4
cycle,
grandes
considering these
componentes, ¿no?
4
Primero, la
major
evaluación,
components.
¿no? Que nos
First, assessment,
permite
which
identificar
allows us to
cuáles son los
identify
variaciones de estado de salud
what
en la
are
comunidad,
the
cuáles
variations
son
in
los
the
factores que
state of the
contribuyen a la
community,
buena o la mala
what are
salud,
those factors that
y
contribute to good or bad
si hay
health,
alguna población
and
específica
whether there's
alrededor.
a specific
Después, para el desarrollo
population
de políticas,
After policy development, it involves intersectoral participation of all stakeholders, and it does allow us to strengthen the healthcare system, and it helps to tackle risk factors and social determinants, which is fundamental. Later, we consider this aspect in resource assignment, and finally, the assignment of guarantee to access. What have we done with this? An instrument is created, which has been run now, and I will tell you a bit more now how progress is going. In 2 states, many state entities have been working under a similar model. What we did at the national level is try to unify all of these experiences that have been had regionally, and it was redesigned with the full effort that was foreseen before, with an instrument with 43 items, which what it seeks is precisely to measure each of the components in the essential duties of public health. And these items, what they are helping us is to identify the areas of opportunity, the strengths. We are doing this measurement in each of the health districts, and I will tell you now what the districts are about, but more or less this is how the process was like. A cell was created in Sonora, city, Mexico City, with support from PAHO. Adjustments were made with support from other entities. It was made some sessions with the whole team to adjust this model. And here it is important to note that in the beginning, the models that worked very specific for some entities, given the reality of the rest, well, they had some adjustments. Then we have this instrument, which we believe is robust, and we are in this process, or in fact, it has now been run, a pilot, in 10 districts in 5 different states. We are in this analysis process, final adjustments to begin running now the diagnosis at the national level. Here's an example where the Quintana Roo team shared, and I took this because I believe it reflects very well how things are going at the national level. This is an example with 4 districts that I will quickly go, but more or less, as you can see, this district turned out 4. Here we can see the diversity here, but it's the same state, Quintana Roo, and in 3 districts, note how there is a major heterogeneity in capabilities or advancements and strengths of public health care in each of them, which leaves very clear the major inequality between capabilities, and this, of course, impacts the response capacity of the state to tend to the health of Mexicans. Finally, we have District 3. Once again, I would like to thank the Quintana Roo team again and the service team that collaborated much and is very much committed with the topic. And now I'm tending to this issue of districts. We ran a pilot in 10, and instruments have been run in the previous year in 2 entities, but in Mexico we have 242 districts, which supposes a major challenge to be able to measure and later to act before this, what we are measuring. But the healthcare districts are these geographical areas made up by some municipalities, 1 or more municipalities, which is the minimum area of territorial governance for health, and which has an authority in governance, which is the jurisdictional authority or district authority, and this allows us to tackle with a responsible team for governing the collective series. And what we do in this service in public health is to accompany the entities a bit through federal governance, but also accompanying and strengthening local governance, both in the state and in the jurisdiction. How do we articulate the action? Because this is what follows. What are we doing? What we're measuring? We are going to have it. And the goalie model, this is how it was christened. If you note, it has four aspects that are inspired and the four aspects of essential public duties. Goli responds to management, operations, logistics, and intelligence. And this also includes the network of coordination with well-being centers for coordination and what accompanies prioritization and funding to capacity funding, citizen participation, transsectorial linkage between logistics, inputs and strategies, and intelligence, monitoring, assessment, and analysis, among others. But a bit, I would like to, I wanted to show you this so it's understood how we are tackling it. And so, what do we seek to do with these metrics? The management aspect seeks to strengthen planning and execution of programs to align with the national goals, the actions, basically ongoing improvement to coordinate efforts among institutions and levels of government, and to prioritize or support resource prioritization and to design strategies for critical areas. The area of operation in brigades, with this information, will accompany essential duties or strengthening of essential duties through the management and involvement of factors that impact the community, territorial activities, emergency situations, and response, and it also provides reliable data for comprehensive and sustainable programs. The logistics aspect seeks to analyze the funding aspect to guarantee availability of medicine and health technology, to assess supply and distribution processes, and to identify resources in the region, and finally, intelligence to detect the strengths and weaknesses in the healthcare information systems to improve compilation and data analysis, to detect diseases, to generate reliable information useful for decision making, and to assess the capability to tend to emergencies and disasters in each of the districts. In conclusion, in Mexico, we are using the essential public health duties as a tool, but also as a theoretical framework to guide the actions of the federal subsecretariat and to strengthen the state services for health. As I said, this ruling authority in the entity and the jurisdictions and sanitation, we seek this cell or this assessment tool to allow us to perform this analysis on how we're standing in the many levels of attention to strengthen the capabilities at the district, state, and federal levels. And also, we consider that it is a tool that is allowing us to strengthen the governance of the federal secretariat, the state services, and the health jurisdiction by accompanying each of these components. And it is also sought to close gaps. As we saw in the Quintana Roo example, there are inequalities, and this will allow also to place more attention where it is needed to close the gaps. And well, basically that this is how we are tending to it from Mexico. Surely there will be some questions, and I'm at your disposal. Great. Thank you so much, Dr. Castañeda, also for sticking to your 10 minutes. And we think the presentation that is so specific on the situation in Mexico and the input from FESP. Now, I would like to hand the floor to Dr. Tamaris Valerio Rosario. I would like to who would like to tell you about the governance of that is fundamental to improve public healthcare systems based on APS. After assessing FESP, the Dominican Republic drafted the National Strategic Plan in Healthcare to 2030 that is based on results and set up sub-regional meetings, and now it is working on a plan for assessment and follow-up of FESP.
en este marco? ¿Cómo ha
In this
contribuido la
framework, how has the assessment of FESP contributed in the Dominican Republic to the strengthening of these leadership and governance areas, and what strategic actions have been identified to be able to continue improving?
También 10 minutos.
I also give 10 minutes to Dr. Valerio. Good morning and thank you. I will give a very synthetic presentation, which is what was requested. The country, as you well stated, ended its assessment in public health care duties successfully and drafted an action plan with an identification of gaps and actions. We dedicated ourselves as a country to develop a monitoring plan for these gaps and actions. This plan is now being formulated and prepared. This plan is articulated to the actions of operational institutional planning in such a way that reports on operational planning go in hand with the development of the actions that will be closing the gaps. This is an important element because it articulates in the center of the planning, it coordinates with the center of planning, the essential duties. On the other hand, we are at the point of formulation of the national policy of health, and a central element to the policy, apart from the perspective based on social determinants, is the matter of the center. One of the centers of policy is the issue of strengthening essential duties. So we have, let's say, two actions underway in that process. They are key elements, I would say strategic, to strengthen the duties and the role of the health authority in the ministry. What is expected in this monitoring plan, which is in the process of design at this time, is to have annually some progress reports to look at how the gaps are being closed and how the duties are being carried out and how we are inputting to the many aspects of the policy needs. In general lines, I will briefly tell you about the actions that are already underway, obeying to that assessment that was made whenever gaps and specific actions were identified under the sectorial planning at this time for the matter of monitoring and assessment. Indeed, certain modules are being developed for the information management system for health, especially the HR module and the data module. In the case of HR, it is now in the process, a national census of human resources throughout the whole health system. It is a development, a test of interoperability for data on the single electronic file, employing the HL7 standard and other, basically with a use test case for basic tests to later extend to the challenge of the production of healthcare services. Then we also have the digital transformation project for MINSMA that articulates many data sources under the coordination of the Office for Information, Statistics, and Health, which intends to strengthen also the staff, health staff in the ministry on the matter of innovation and the use of communication technologies. We're also strengthening the digital governance. We're building a strategic committee on digital health by presidential decree in a way that it decides to build a governance mechanism based on IT systems. These elements aim directly to the strengthening of a monitoring assessment system and to input to the interoperability and the interconnection among systems. With regards to risk control and multiple hazard control, 7 assessments have been developed in high-risk hospitals nationwide, and surveillance, epidemiological surveillance has been strengthened in those centers with more governance. Also, the staff has been trained regarding the matter of emergencies and disasters. 60 sectors have already been trained in methodology of risk management, and it continues to be developed an expansion plan. Regarding research and knowledge management, it will be drafted the National Healthcare Survey as a fundamental baseline for healthcare training, noting that more than 10 or 15 years it's not been carried out, and for the first time it will be executed as an important pillar for the whole IT system and monitoring the healthcare system. With regards to F5 participation and social mobilization, it's been strengthened, a structure of strengthening social participation in health 48 commissions have been citizen oversight in 38 districts, more than many community forums with priority healthcare issues. It's been reviewed already, the technical regulation for the working of oversight commissions, and academic program is being developed in provinces. We have a subnational level, which is provincial, at the level of healthcare services, of governance, at the level of the Ministry of Health system, at the level of service provision. There's a regional organization. So we have two ways of organization. In our case, the matter of these academic programs linked to the province level. On the other hand, the plan is in the process of implementation. This process of creation of which is a participatory process with regards to point 4 regulation framework. At this time, the national healthcare policy is being formulated, which has a focus, should have a focus on social determinants, and it is fundamental a participatory process at this time, and it is centered on duties of the Ministry and strengthening the essential duties of the Ministry of Health. On the other hand, on legal aspects for universal coverage, it's already drafted, being modified, a law of mental health.
We also developed the national policy, a national policy, and we're carrying out a review of this one. And we also set up documents for the development of careers in the health system. And in this same line, we have also integrated new professionals into our team through a contest, and we have also sent these new professionals the names of these professionals to the Ministry of Health to be incorporated. And apart from developing our human resources and strengthening our system, we are also developing a national training plan in order to develop the capacities and improve the services. Regarding just the number 7, the measure number 7, we have approved the medications and the heart, according to the heart strategy, and based on the population number. And we are also developing norms and regulations about the occasional use of medication. And the issue of health is being strengthened, and we are right now preparing also the national accounts, and we have also strengthened the provincial divisions in order to improve the budget development and application. And the HARS strategy is also being applied at first level centers, care centers, and we prioritize certain interventions at national level because they belong to primary care. And function 10, all these measures are carried out also for dengue and other endemic diseases, and we are right now assessing these measures. And the mental health care plan 24-28 and also the respect for human rights are being incorporated into our measures. We are doing a diagnosis about the care for the care for patients at primary health care centers and their registration. And we are taking into account the social determinants, and we are also incorporating the equality of care in our regulations, and all the issue of training and promotion is also being incorporated into the social determinants. You have 1 minute. And finally, we are preparing what would be the evaluation of essential functions in the provinces. We have a document or instrument to be applied at provincial level, and we are going to improve that tool and by incorporating the essential functions at territorial level. We hope that this evaluation will take place this year, and so that we can set up a new plan for next year. Thank you.
Muchísimas gracias, doctora Valerio, por su
Thank you,
presentación
Dr.
y detallado plan.
Valerio, for your detailed plan and presentation. I would also like to mention to the panelists that there are questions in the chat, and if you can answer them, we would thank you for it. Well, I believe that we are within the time frame, and hand over the floor to the third panelist, Dr. Guerrero, from the Ministry of Health in Colombia, was a leader together with PAHO in what concerns territorial measures and governance management in the different regions and departments. So the question would be what strategies or plans are being identified in order to fill the gaps and correct the deficiencies detected. And what's the role of the training of health staff in order to close these gaps? Thank you. You have 10 minutes. Thank you for this invitation. My presentation, according to what you required, will be focused on human talent. I would like previously to provide a context. Colombia is during this time reforming it's in a process of reformation of its health system, but we also have a financial crisis, and this has an influence on the former issue. But apart from working on human talent, which is one of the priorities of the government, we are focusing on the goals mentioned. We have worked in measuring in checking the skills of our staff. We have measured it for the whole countries and all functions, and before going on, all of us should be clear about what we mean about the reformation of the health system in Colombia, which is now being reviewed by Parliament. Colombia goes ahead in order to reduce is trying to reduce financial intermediation and stressing the right to health, to good health, as a human right and not a market issue. So we are focusing on all financial levels, and we are also accelerating primary health care development with teams that are clearly that are well trained, and we are stressing the function of the administrators. Right now, the administration just pays the bills of the different service providers. But if we have a smart banking system with intelligent, with smart audits, etc., we would be able to develop a better methodology, because civil society asks for a greater transparency in the management of the resources of health sector. And we have to accelerate the growth of the regions, the growth of integrated networks in the regions focused on primary health care. This is a framework in which we are developing these measures, and the process of measuring our human skills, we would say that Colombia faces critical challenges, especially for the training and assigning of human talent. We have to improve our content, educational content, and also introduce continuous learning in a concerted manner and taking into account the differences between regions in Colombia and using or profiting from the potential we have in the private and the public system. We have a well-developed private system, and we have many private service providers, and we have to establish synergies between the private and the public system. Therefore, it's important to face this as a challenge that we have to face as soon as possible, because we have to profit from this situation in order to improve our human talent and the services provided to the population. The Chamber of Representatives during the past 2 weeks has introduced a specific article to incentivize this change from starting from the legislative power, that is to provide sufficient funds for all health professionals and services. And we're working together with the unions and the workers that have been demanding for since many years ago better working conditions and better salaries. And we have found interesting factors. One is the definition of content in the academic issues. We know that the degrees and postgraduate degrees are in hands of universities, and without interfering with the university's autonomy, we're trying to improve the educational programs regarding public health using the determinants for health. We have to know what is happening in the global context and what the repercussions are in the different countries, and how we are going to look at the social determinants for health and the independence of these determining factors have to be understood by students in the best way possible in order to make progress. We have also seen through these measurements that the progress in cooperation among different professions regarding management of health and improving communication skills and maintaining ethical functions and values and setting up public health as one of the main pillars for change. And to this end, will require measures that are centered on people and communities, following the strategies for primary health care. And one of the points of this reform is to grow and accelerate the number of baseline teams. And we want to have 15 to 20,000 teams, and this is not easy. It takes time because it's a large-scale change. We have to improve this by carrying out measurements of essential functions, and we want to work at a large scale to set up community centers that are close to the families and to schools, and also center our efforts on the hospital part. This is, well, in relationship with primary healthcare and specialties, we have to count on regular financing and training models based on people or focused on people. And by acting in this way, what we require as a budget, we need a specific budget for primary health care in order to turn this into a reality. And we need also a specialized, specifically trained specialty workers in the different specialties and distribute these employees among the regions in a rational manner. And we need to evaluate human resources in the different regions by setting specific goals and establishing financing resources, and we need to maintain the participation through studies and monitoring in order to see what is working better or best in different places. And we need to make progress also regarding the analysis of salaries and studies offered to professionals at different levels. And we could also say in the plans of what Colombia is doing, we have to focus on the municipalities. During the first half year, the first semester, we are focusing on a group of professionals in the training, the new staff, administrative staff, in care of public health. And during the second semester, we will implement networks of training and services with the participation of the health secretariat and the different healthcare providers also. And we want to register the activities that are carried out in the different territories, both by the Ministry of Health and the different health secretariats, in order to understand what is happening in our country. We believe it's important that in the process of training, we also review what progress we have made with different actors. It's different what we do in the superintendency to remodulate the system in order to achieve financial sustainability and changing the model of care. But we also need to train the administrative staff in order to carry out payments in the best manner possible. And it's important to make progress in developing the role of service providers and strengthen public hospitals that will not be thinking about financial profitability, but social profitability and sustained maintenance of expenses. And we need networks of health services. Finally, I would like to say that the virtual campus for public health in Colombia has become a strategic access to set up pedagogical itineraries that are important for human talent. Thank you very much.
Thank you so much, Dr. Guerrero.
Thank you, Dr. Guerrero, and thank you for interrupting you, but we have to try to keep in time.
Muchísimas gracias por sus explicaciones sobre
Thank you so much for your explanations on the impact of FESP in Colombia and on the assessment that was made at the level of territorial entities. Now, I would hand the floor to Dr. Monar Munar, sorry. Dr. Munar, the assessment of capabilities in healthcare systems to develop and implement FESP plays a fundamental role in its strengthening, given it allows to identify areas for improvement. In what ways can assessment contribute to improving FESPs in the healthcare systems in the region, and how can the outcomes from these assessments be employed not only to measure the performance of healthcare systems, but also to inform future policies that may contribute to the strengthening of FESPs? You also have 10 minutes, Dr. Monar.
Gracias.
Come in, please.
Quiero agradecer
Thank you
al
so
pueblo
much.
de
First, I
Italia
would
por la
like to thank Ernesto and
invitación
Natalia
y
for the
por esta
invitation and
pregunta
for
tan
this
interesante.
question that's so
Pese a mi
interesting.
nombre
In
teutónico,
spite
soy
of my
colombiano también.
Teutonic name, I'm
Quiero abordar
also
la
Colombian,
respuesta
by the way.
o
I would like
las
to
dos
tackle the
preguntas
answer
desde la
to the two
perspectiva
questions
que
from
conozco, que es la
the
de mi campo, que es la
perspective that I
investigación,
know
políticas y sistemas de
which is
salud.
on my field,
Todos sabemos
and this is
que
healthcare systems and policies.
es un campo
We all know this is
interdisciplinario
an
que pretende entender y
interdisciplinary field
mejorar
which attempts
la
to
forma como las
understand and improve the ways
sociedades
in which
se organizan
societies
para lograr sus metas
organize
colectivas
to
de salud.
achieve their collective
Por
healthcare
ello,
goals. Therefore,
habría una tentación como
there would
académico
be a
de
temptation as an
meterme en
academic to
profundidades
get in
metodológicas y
depth
técnicas, pero
into
obviamente no lo haré
methodological
y no se
issues and
preocupen.
techniques, but
Quiero tener
I
un
won't be
enfoque
doing that. Don't worry.
pragmático y quiero
I would like to have
celebrar el avance
propose a pragmatic
que se
perspective, and I
nota en
would
la
like to
región en
celebrate
este tema
the
tan importante.
progress that is notable in the region
Creo
on
que
such
como
an
todos
important
hemos
matter.
visto
I believe that, as
las
we have all
diferentes
seen,
evaluaciones de
the many
funciones
assessments
esenciales,
of
tal como se
essential
plantearon en las
duties as they were
presentaciones
proposed
previas,
in previous
con gran
presentations
riqueza ayudan a generar
with
evidencia sobre
great
el
wealth
impacto de
helps to
gobernanza
generate evidence for
y los recursos,
and by governance on the
seres
resources
humanos, etcétera, el desempeño de las propias
that stem
funciones
from humans and
e
so on the
informar las
performance of the very
decisiones
duties and to inform
a lo
the
largo del ciclo
decisions
de política
throughout
sanitaria en cada país.
the health
Esto
policy
quedó muy
cycle
claro en la
in every country. This
presentación
was
original del
left
doctor
very
Jarbas,
clear in Dr.
Eduardo y
Jarva's
Natalia, pero
original presentation,
lo
Eduardo
demostró
Natalia,
en la
but
práctica
they
ese
demonstrated this in
potencial
practice on
en
that
todas las
potential
presentaciones de los países.
all country
Y yo
presentations.
recordaría que
And I
este
would
esfuerzo que
remind
han estado
that this
haciendo
effort that they
en la
have been
evaluación de las
doing
funciones
in
esenciales
assessment of
es un
essential
símbolo
duties
de
is in itself
investigación
an
aplicada
example of applied
en
research
políticas y sistemas de salud.
on
Eso merece un
healthcare
gran aplauso, en mi
policies
opinión.
and systems,
En este
which
marco,
deserves a round of applause, in
creo
my opinion.
que
In this framework, I
quiero
believe
resaltar
I would like to
una palabra
highlight
que han usado
a word
todos
that's been
los
used by
tres
all
analistas
three
cuando hablaron de
panelists
los procesos.
when
Aquí
they
quiero poner
spoke of the
procesos como el
processes. And
tema
here I would like to
clave
set process
de las
sees as
evaluaciones
the
de las
key issue
capacidades
on
para ejercer las
assessment of
funciones
capabilities
asociadas
to carry
con la
out the
guía
essential duties
que ha
with
suministrado la
the guide
OPS.
that has been
Y yo
provided by
propondría que para responder a las preguntas
PAHO.
que me han
And I
hecho,
would say that
vayamos
to
de
answer the
esos procesos
questions that have been made to
regionales
me, we would
más
say
allá de
that
la
those regional
medición, que es
processes
la
beyond
parte
measurement,
más
which is
académica,
the more
y que
academic part,
consideremos de
where we should
manera
consider
colectiva
in a
su
collective
potencial
manner
valor para
its potential
impulsar
value
una mentalidad de
to
aprendizaje
harvest a
también colectivo,
learning
pero a
mindset,
múltiples
also
niveles
collective, but at
en los
many
sistemas de salud,
levels
a nivel
in the healthcare
subnacional,
systems and
que ha
also
sido
subnational, which
reiteradamente
has been
presentado en las tres
repeatedly
presentaciones
presented in
previas,
all three previous
obviamente a los niveles
presentations,
nacionales
obviously at the
y el
national
nivel
levels
regional con
and
ese
in the regional
llamado de la
level with that
OPS a
call
crear una
from
red.
PAHO to set up a network,
Eso es
which
una
that
perfecta
is a
imagen
perfect image,
fractal, si quieren,
fractal, if
de
you
las
will,
interdependencias
of
e
the
interrelaciones que se
interdependencies and
pueden generar
interrelations that can be
alrededor
generated
de la evaluación
around
como
the
una
assessment
nueva
as
mentalidad
a new
de
mindset
aprendizaje
of
colectivo,
learning,
de
collective learning,
mejoramiento continuo a lo largo
ongoing
del tiempo.
improvement throughout
Entonces,
time. So,
¿cómo respondería yo a
how
esta
would I
oportunidad?
answer to
Primero,
this
resaltando que el
opportunity?
enfoque
First,
propuesto por la
highlighting that
OPS
the
está centrado
perspective
en
posed by by
capacidades
PAHO is
de los actores del
centered on
sistema de salud,
capabilities of the
lo
actors of the
cual, a
healthcare
mi
system,
manera de ver, ha
which,
creado
in my way of
oportunidades
seeing it, has
para poder
created
echar en
opportunities
marcha estos esfuerzos
to
colectivos de
put underway these
aprendizaje que
collective
voy a
efforts of learning that
definir
I will
muy,
define
más bien aterrizado,
very
pero muy
actually
superficialmente a
delayed, very
continuación.
superficially
Creo
next.
que todos
I
hemos sido
believe
conscientes de
that
que las
we have all
evaluaciones
been
que
aware
hemos
that the
visto, las
assessments
que
that
yo
we
por lo
have
menos he leído,
seen, the
están
ones that I've read
publicadas en
through at least
Colombia,
that are
etcétera,
published in Colombia and
cubren
so
la
on,
totalidad del espectro de las
cover the
funciones.
total
Eso es
specter of
en
the
sí
duties.
mismo
That in
fabuloso porque
itself
nos da
is
una
fabulous
visión
because it gives us a vision,
total, global.
a total global
Como
vision.
hemos
As we have learned and listened, there are strengths that have been detected and that the capabilities are on average between limited to moderate, and there are some common challenges in the region. For example, on the matter of my interest today, which is monitoring and assessment and health research. But I believe that diagnosis is vital. I've been thinking in the last week, and I would say that what has guided my conceptualization is the question on what more can be done by healthcare leaders in the region with this kind of evidence. And from then, I've thought in what way can a catalytic effort be generated which helps to nurture this that I'm calling a collective mindset of learning. The first to be done would be not to pursue the assessment as a final note or score, for calling so, but to look at it as a source of learning. It's important to understand that results from assessments, such as the ones we've been listening to today, can help us to foster curiosity and to ask ourselves, why did we get these results? To create social spaces, such as the ones we have heard in the previous presentations, where many social actors can think in a systematic way regarding the evidence obtained and to apply critical reflection and to question our judgment, and based on all of that to adapt public healthcare strategies and policies. By the nature or political nature of the systems in our countries, of the political systems, and the very complexity of healthcare systems, to focus this kind of learning process is no easy task. It is important to remember that in this political complexity and in our healthcare systems, which have a global connection and local connection, very well known by all, the uncertainty and the ongoing change are the only constants. From there, that a static perspective for assessment to repair gaps is not enough. Resiliency that we have been speaking of and ongoing improvement of systems require a perspective on capabilities, employing this term from Pajo collective of adaptation and learning, in a way that if we're going to employ assessment as I'm proposing as a collective source of learning, we would have to reinterpret it at least in the following ways. First, regarding formal capabilities, we should ask ourselves up to what degree do they allow or hinder our current health policies, learning, ongoing improvement, and adaptation based on evidence and assessment evidence. Those contextual barriers exist. What do we do before them? Second, the structural capability. Up to what degree does it facilitate our current structures and routines, practices, organizational learning among the actors in the system who are responsible for many essential public health duties? Up to what degree those practices and organizations contribute to maintaining organizational silos? To what degree evaluation evidence helps to break those silos and in some cases to reinforce them? Third, regarding supervision capabilities, let's think if we use monitoring and assessment of the functions, though this is applicable to other elements in the system, really to improve and correct the direction, or are we doing it to fulfill internal requirements and sometimes external? And finally, thinking about the capabilities of performance, I ask myself whether we are assigning resources or are we requiring resources to act or to make, or if we are also including resources to reflect, learn, improve, and innovate. And these resources may be not only money, but also time and people. Tending to these points would require first to fund monitoring and assessment system of learning which are robust. That's where the methodological and technical aspect lies. Second, to train, as has been stated already, to the people, but in this case, in assessment thinking, that capability to be critical and reflexive and to employ evidence and to put into question assumptions and so on. Third, in my opinion, in my research experience, one of the most important aspects for the success of any network is to set up social spaces for interaction, to share lessons, to learn together, to compare ourselves, and not necessarily in a competitive way. And finally, to dedicate time and resources to reflection for policy, reflection, strategical reflection. I'm not only saying only operational reflection. Now, I'm not saying that these four things are not being done, but what I am referring to is doing so collectively is not the same than doing it within ministries. The collective way, we are speaking of putting people and communities and other social actors, as PAHO data presented by Natalia has shown. We are speaking of many social actors to adhere to that exchange process participatory throughout time, because this is important. I believe the mapping we have seen told us clearly on the diversity of actors, but we are speaking different languages in such a way that for the collective learning to flow, it requires a common language, and I propose for that language to be produced by the evaluation, the empirical evidence, and that language should be created in a collective manner, because in that way we would have a common understandings to be able to improve the healthcare system. So, to close, I would say as possible recommendations to consider first, to frame explicitly the action plans that have been prepared by countries as agendas of learning, not as plans only. Second, to strengthen, and this sounds as a commonplace, but with the results that we have in front of us, it's undeniable that we need to strengthen the essential duties in monitoring, assessment, and healthcare research, but with clear mandates to generate evidence that is actionable for improvement and also to help translate the knowledge and evidence into new policies and practices. And third, to create and to sustain these exchange spaces with multiple actors that I already mentioned. And last, to invest in people. And this is training human talent, not only on technical abilities that we have discussed, but also in assessment, reflective, or critical thinking. And lastly, I would say these initiatives that are being proposed by the organization would be those who would free this potential of assessment to foster change. And for that reason, I believe it deserves a whole round of applause. The team that has been presented before me and the collective effort from PAHO to promote this discussion. Thank you so much. Thank you so much, Dr. Munar, for your intervention. Also, thank you for sticking to time. Now, I would like to hand the floor to Dr. Sahel Sekat. Doctor, the essential duties in public health have received a growing priority in all the world and with many resolutions at the regional and global level in WHO that are asking directly the strengthening of essential public healthcare duties. With the impact of COVID-19, the events related to climate change and other health challenges that we are facing, what role do you consider that FESPs play in the construction of resilient public health conditions worldwide? And also, what are key actions necessary to reinforce the capability of FESP with the goal of improving resilience and global health long term? Come in, Dr. Sakat, please.
Good morning, colleagues, and thank you, Chair. I think we are in an era of polycrisis, from a global to country level context, from infectious disease to NCD to climate change, as well as war and conflict affecting quarter of a global population. And then if you recall our time,
luego,
COVID-19, 7 million people died due to COVID-19. And in addition, around 14 to 17 million also died due to the collapse of the health systems. So the resilience, I think if you look at those contexts, it was not just an issue of low-income countries. It was a necessity identified for countries in all income groups, even countries with an advanced public health system. But the issue is that the prevailing way of looking at health systems, investing in health systems, has been very, very siloed, very transactional. So the health system was oriented only to provide one-to-one medical care. So the public health positioning has not been adequately pronounced or not oriented enough. So the relationship between resilience and public health function is an inevitable one. Just before I said that relationship, I think resilience is what we want as an objective to achieve. And it's not just for health security. We need resilience in our health systems for universal health coverage, as well as for health security. Both are interdependent, as well as the interdependence between USC health security and other sustainable development goal, as we had seen cross-sectoral impact from national to global level during the course of COVID-19. So essential public health function is basically the critical part how to achieve resilience in our health systems. So in terms of the role it provides, one, the work that Ernesto and colleagues are leading from PAHO is very, very complementary to the work we are also doing from WHO headquarters by harnessing PAHO and other regional experience, coming up with a unified list of public health function, defining the bundle of public health services. So this is allowing what an operational public health should look like from policy to planning to practice to service delivery. So EPHF providing that operational scope for public health. So that one. Second one, in any country, if you look at the distribution of public health function and service, they are not all located within Ministry of Health. They are located within and across Ministry of Health as well as in allied sector. For example, water and sanitations, environmental health, climate change, social care, flood protection, many of them are not part of Ministry of Health. So using EPHF, if you look at them, you can provide that intersectorality clearly prominent as well as into action for coalition of action between Ministry of Health and allied ministries. So that is the second role it provides. Third one, very, very important. We often talk about primary care. In the PSC operational framework, you have seen that in terms of integrated service delivery, it positions public health with primary care. But we need to reflect us in how many countries primary care is really, really embracing public health function and services. So what we would like to change in that context is better defining the role of primary care, that is not all about one-to-one medical care. The role of primary care is also to provide public health function and services so that we'll have a better defense, better defense to protect the health system, to protect the population from the impact of disruptive public health event, as well as to safeguard other government business functions. We do not want a repetition of what we have seen during COVID-19. Now, in terms of what are the key actions, I think you have covered a lot. You have been championing in a number of countries in Americas. I think from a global point of view, we are aligned with you. So the first action for every country is to define the current baseline for public health according to essential public health function and also the way we are bundling public health services. And we have done that type of rapid strategic scoping in country like Ireland, so that you have a better evidence of as a country where we are now for public health function and services. What are the areas that we have critical gap? What are the areas we have the capacity in line with current and future burden of disease and population health need assessment? Second one, given distributed and dispersed nature of public health, we need to come up with a fit for purpose governance for public health within and across health and allied sector. Without a functional governance mechanism, we cannot anticipate intersectoral coordination and accountability for public health be in place. So it's very, very, very important. And if there is a National Public Health Institute, or if there is no National Public Health Institute, we need to define the role of Ministry of Health and NPHI in that coordination mechanism. And we need to have the right power and delegation so that we are not going to expect that it's going to fail. Third one, as I mentioned, we need to better define the role of primary care and other subnational structure in terms of delivery of package of public health function and services. I think EPHF can be viewed as a broad concept, but the work we are doing from Geneva office from a global perspective with Ernest to another regional office is to come up with a package. If you come up with a package for public health function and services, then countries can do benchmarking. Okay, we are doing X, Y, and Z, but we have limitation in some other areas. So the work that we are doing is defining that bundle. Then the other important one, I think we all know the problem with workforce shortage. I think what we also need to come up with that public health workforce for public health, not just located within Ministry of Health. Workforce for public health is also available in allied sector. We need to account them. We need to account them in peacetime. We need to build their skills and competency during peacetime so that we can have a better denominator to define the scope of health workforce for public health. So very, very important. And then the final one, there's a key actions. I think often we look at public health in a very, very isolated way. We need to look at public health in a sector-wide approach. How public health is considered in health sector related policy planning and budgeting. How public health is considered in infrastructure and coordination, and then service delivery mechanisms. And then lastly, in terms of the way health systems functions and services are being monitored. We are doing a project with a public health agency, Canada, and we looked at all types of monitoring tools from a public health lens. And
Dr.
we
Saikar, 1
seen
minute,
that
please.
is
Sorry
very,
about that.
very, very isolated. So, and then lastly, we as a WHO are coming into a new program of work, and first time we have an output indicators to measure institutional capacity for public health function and resilience at country level. So something to look forward to and force further collaborations with our colleagues and partners at country level. Thanks a lot. Back to you.
Thank you very much, Dr. Saikat, for your intervention and sticking to the 10 minutes. Quisiera agradecer, como le decía al doctor Saikat, por sus comentarios y su intervención, así también como a todos
We'd
los
like to thank the
panelistas
doctor for his
anteriores por
comments and
enriquecer
participation, and also
la discusión
our
sobre las FES.
previous speakers
Quisiera mencionar que hay
for
varias
advancing
preguntas a
conditions
nivel del
on
chat
FESP. I would like
que
to
pueden
note that there are many questions via the chat.
entrar y responderlas. Se lo
If you could
agradeceríamos.
get in to answer them, we would be grateful. But I believe this has been a quite fluent and enriching conversation. Before moving on to conclusions, I would also like to remind you that the recording of the event and presentations and all other materials will be on the webpage. I know that in some of the comments via the chat, they were asking this, and we will share the link via the chat. And finally, to finish and round this conversation, I would hand the floor to Dr. Vascolo, Primary Health and Integrated Services, PAHO, to wrap the event. Come in, Ernesto. Thank you very much, Anna, for moderating this fantastic seminar. It's been easy, but impassioning, and organizing times, I believe, was a challenge for yourself and for everyone. So really huge thanks, but also Dr. Barbosa, who was our leader, not only as director at this time, but previously. I would like to highlight that this last stage that I said between 2019 and 2022, this day, has been crucial to define the agenda that we're leading at this time. I would also like to thank Andres Castañeda Prado from Mexico for his commitment, to Tomoris Valerio Rosario from the Dominican Republic, our dear friend Eduardo Guerrero, Chair of the Colombian Association of Public Health, Dr. Munar from the University of George Washington University, his reflections, and also reflections from Sohel Saikat from the World Health Organization, the success of the participation also of the very chat. We have had the participation of 1,700 participants, but only considering those who have expressed via the chat from 31 countries. I will mention them quickly: Antigua and Barbuda, Argentina, Bahamas, Barbados, Bolivia, Brazil, the British Virgin Islands, Chile, Colombia, Costa Rica, Cuba, Ecuador, the United States, El Salvador, Spain, France, Guatemala, Honduras, the Cayman Islands, Jamaica, Mexico, Nicaragua, Panama, Paraguay, Peru, the Dominican Republic, St. Lucia, Suriname, Trinidad and Tobago, Uruguay, Venezuela. But these are just those that have taken part via the chat. 31 countries that have expressed gratitude, commitment, questions. I believe this was one of the most impressive webinars we've had in the department. I would like to thank everyone because there's also many who have not expressed themselves, but have been present. You're part of our series, and well, our joy is huge. But I would like to highlight some key points that came up during this fantastic discussion. Some reflections on results from presentations, because on the results from the publication, Dr. Monar developed to me fantastically this technical discussion conceptual, political on assessment capabilities, but I would also like to give account of the relevance and knowing the results that we have presented on the essential duties related to access and resource capabilities and supervision capabilities. I believe are elements to me very interesting because access on in an integrated manner, not only individual services, but also collective interventions and intersectorial, but in certain territories, they are one of the major challenges that we have in the region, where the population lives in conditions of greater vulnerability, where we need to gear financial and human resources, medicines and supplies should be in the locations where they're needed, and also the development of capabilities that pertain to supervision. And that obviously is related not only to the capacity for assessment, but of accountability before society. But also regarding the presentations that we were able to listen to today, in the case of the Dominican Republic, a very national perspective, but also the experience of the implementation of essential duties in public health, both in Mexico and Colombia, shows us the importance of this agenda, not only to tackle it at the subnational level, but for it to transform into a fundamental axis of reform processes. This word that also Monar mentioned to us as a magic word. We are not only before significant challenges in the region, but that we are riding on very important change processes. In that framework, I would like to highlight the importance in leadership, governance, and rectory to accompany these processes. It is clear that, of course, we also need to have solid governance structures, which is fundamental, and to strengthen essential duties in public health with an axis on a narrative that contain us not only in the world but in the world, and this is advancing on sustainable and equitable and resilient systems, and with the APS perspective as a central pillar. It is also essential the ongoing process, as I said, for assessment, as I said before. Many of us need to learn about that. Periodic assessments allows us to identify challenges, to acknowledge the progress, to adjust our strategies to ensure a process and a progress which is substantial and significant, where we can show the improvements that we build regarding the population's healthcare conditions. It is through this process, which is interactive, that we can guarantee the success in the long run and make it so that it's sustainable, not only in financial terms, but also to make it sustainable in political and institutional terms, these processes. Another crucial aspect that was highlighted today is the strengthening of the purview of the public healthcare staff, not only because professionals require the skills, knowledge, and tools which are necessary to implement effectively essential public healthcare duties, but because healthcare professionals are the fundamental actor in the collective action that will carry this agenda forward. Lastly, I would like to acknowledge the firm global commitment with the strengthening of essential public healthcare duties, the support from international organizations, governments, and allies are key to further this agenda and to guarantee that we will work collectively for an America's region that is more healthy and resilient. From PAHO, we reinstate our commitment to continue advancing and supporting countries in the region in strengthening of these capabilities and to promote, as was the case here,
exchange spaces for exchange between countries. It is in here where I mentioned the creation of a network of governance for the essential public health care duties, where we will be inviting all of you individually and collectively as professionals, but also through your institutions and organizations to finish this webinar. I would like to reinstate my gratitude to all individuals that have participated, so presenters and organizations that have dedicated their time and their valuable contributions. The deployment of this regional report sets only the beginning of our commitment collective to build resilient healthcare systems in the Americas. To the measure that we continue advancing in the strengthening of FESPs, let's do so with determination, collaboration, and a shared vision for the health and well-being of all individuals. Thank you so much. Have an excellent rest of your day. Thank you, Ernesto, and thank you so much to all our participants. We have reached almost 1,600 participants, and obviously to our panelists for their excellent intervention. Thank you so much, everyone.